Hi, today we're going to be talking about a citation that the Illinois Department of Public Health issued to Villa Clara Post-Acute Care Center Nursing Home in Decatur after a resident there ended up being taken to the hospital due to dehydration. My name is Barry Doyle. I am a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, which is a free report available for download from my website, which explains why the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. So, one of the basic functions of a member of the nursing staff in a nursing home is to serve as the eyes and ears for doctors. When a resident is admitted to a nursing home, they are assigned an attending physician who is in charge of managing the care of that resident. Now, the doctor isn't there on a 24/7 basis. Doctors aren't at a nursing home on a 24/7 basis at all. And so the members of the nursing staff have to alert doctors when there is a change in condition with regard to one of their residents. Once there's a doctor is notified of a change in condition, there are three basic things that might happen. One is that the doctor may choose to come into the nursing home and evaluate the resident themselves. Secondly, they may send the resident off to the hospital to be treated there, or they may just issue orders over the phone for the nursing staff to give medication, to have labs taken, etc. But in order for these things to happen, the doctor does have to know that there has been a change in condition, and the failure to notify the doctor of a change in condition is something that can lead to significant problems for a nursing home resident. This particular nursing home resident had a history of kidney cancer, had one of his kidneys removed. He also had chronic kidney disease with regard to the remaining kidney and had a chronic indwelling catheter. What a catheter is, it's a device which allows urine to pass from the bladder into a collection bag. Generally, the use of catheters are discouraged in the long-term care industry. One of the basic problems with them is that it provides an opening for bacteria to enter into the urinary tract and can cause urinary tract infections. The upside to having a catheter, one of the upsides to it, is that the urinary output can be measured fairly precisely on a day-to-day basis. And when a resident has a indwelling catheter, a chronic catheter like this resident had, one of the things that should be done on a shift-to-shift basis is recording what the resident's output is. Increases or decreases in the amount of urinary input can be a sign that there is some type of illness or other problem going on with the resident and should lead to physician notification. So, in the days leading up to this particular resident being taken to the hospital, he had begun to demonstrate problems with nausea, decreased appetite, increased lethargy. And these are all things that should be signs of a change in condition for a member of the nursing staff and should lead to physician notification. The nurses aren't required to know what the significance of those are. They aren't required to diagnose why a resident has increased lethargy, for example, but they do need to let the doctor know that this is happening so that the doctor can make decisions about how to proceed with the care of the resident. Leading up to the day that the resident was sent to the hospital, there have been several days where increased lethargy, among other symptoms, had been present. They really hadn't been documented. In fact, one of the things that hadn't been documented on any regular basis was the amount of urinary output that this resident had. On the day that the resident was sent to the hospital, the resident's son was at the nursing home visiting him. He was concerned that his father was dehydrated, and the nurse observed that the resident had decreased skin turgor and dry lips, all of which can be a sign of dehydration. The nurse contacted the doctor, and the doctor ordered stat or emergency labs to be done. The lab results that came back show that there were some critically high levels and other levels that were out of the normal range, which were all indications of dehydration, and the resident was sent to the hospital by the doctor. Once the resident arrived at the hospital, he was diagnosed as suffering from acute kidney injury on top of chronic kidney injury to the one remaining kidney that he had. And at the time the citation was being written, there was consideration to having this resident put on dialysis long term, which is obviously a significant change in this resident's condition, and certainly a issue that the resident shouldn't have had to undergo had the doctor's been notified of the problems that had been developing for this resident in the days leading up to this occurrence. So I hope you found this interesting. My name is Barry Doyle. If you have any questions regarding this video or any issue regarding a nursing home, feel free to reach out to me at 312-263-1080, or you can reach us on the web at www.accidentlawillinois.com. Thank you so much for watching.